Hi, my name is Delana Rodgers. I'm a registered nurse at Bone and Joint Hospital at St. Anthony in Oklahoma City. I've worked at Bone and Joint for 9 years, first as a CNA while I was studying to be a radiology tech. I loved what I was doing so much that I changed my major to nursing. In the Joint Replacement Center, we care for patients and their families right after post-op recovery all the way through to their discharge home. I love helping people, whether it's just assisting someone to the bathroom, helping them to ease their pain, or just to make someone's day a little brighter. The wonderful thing about working at Bone and Joint is that our patients most always leave the hospital with less pain, more hope for a normal life, and happier than they were when they were admitted. They let us know that through their letters and cards of thanks, which really makes doing what we do a joy. To be a good nurse, I feel it takes care, compassion, and patience. So it also takes good communication skills. I'd like to tell you a story to illustrate what I mean. A patient and her family wanted to go home after her hospital stay rather than to an inpatient rehab or skilled nursing facility. The case manager insisted that the patient would benefit from rehab or a skilled nursing facility. The patient and her family were pretty upset, to the point where she and her husband were both crying because they felt like they were not being listened to or given a choice. Trying to help them while they were so upset was really difficult for me. I consoled them, and then I asked them what they wanted to do. They stated again that they wanted to take her home. I spoke to the case manager on behalf of my patient and her family. I explained that the patient really wanted to go home and that her family felt safe in taking care of her despite the fact that she was not walking very well on her own. The case manager, after consulting the surgeon, agreed that if the patient would spend one more night in the hospital, she could go home the next day. The patient and her family agreed that one more night would be good, especially since she would get one more round of physical therapy the next morning before she went home. When the patient left the hospital the next day to return to her home, she and her family were very glad that she stayed the extra night and participated in physical therapy. I got a really nice letter from my patient and her family letting me know how well she's doing at home and how much they appreciated my help. At the end of the day, my patient and her family were happy and taken care of, and that's what matters most of all to me. Care, compassion, patience, listening, and communication. We all have time for those basic needs. Thank you.